Hi everybody, welcome to the webinar of Suisselle. I'm Dr. Gabriel Siquier.
Good morning everyone. So let me present our speaker for today. Let's wait for a few seconds, people are connecting. So good morning everyone. Today we have a wonderful speaker, Dr. Gabriel Siquier. He is a leading specialist in aesthetic medicine field, a founder of Dameto clinics in Netherlands and Spain. He is a certified member of Dutch Aesthetic Society and also a part of a research group in Spain at Girona University. And of course, he is now mostly well-known key opinion leader and researcher who is doing a lot of researches and publish it worldwide. So thank you, Gabriel, for joining us today. We welcome you. We welcome you, and I give you time to talk. Thank you.
Thank you very much, Valeria, for this presentation. And I'm going to start sharing my screen. Today we are going to talk about CHAC technology and Cellbooster because we have a few new things, new products. These are my affiliation, as Valeria explained. And I'm going to talk also a little bit about Suisselle. Suisselle is a science-driven Swiss company, and they have a strong focus on the field of aesthetic medicine. They are looking always for the best product quality, and they are following very strict safety standards. Let's go and see a video about them. So very nice presentation. The vision is of Suisselle is upholding beauty, science, and innovation. So if we are looking to the ingredients of the Cellbooster, we see that the key ingredient is hyaluronic acid. Hyaluronic acid is one of the main components of the extracellular matrix, so it has a structural capacity and creates some links within the other glucoproteins, proteoglycans that we have in the skin. It's important, the hyaluronic acid, for two things. First of all, thanks to his hydrophilic properties, will help us for hydration and the regulation of the moisture, and will also promote the collagen and elastin formation. So we will have a better skin firmness. The problem when we are injecting native HA in the skin is that will be quickly degraded within 24-48 hours. Why this will happen is because in our own body we have hyaluronidase that will slowly degrade, will slowly cut the hyaluronic acid particle. Then we have also sun radiation that will also degrade the hyaluronic acid, some pollutants, way of living, smoking, drinking, and chemical stress, cellular stress will also degrade this hyaluronic acid. So if we want to have a longer effect, we need to find a way to stabilize this hyaluronic acid to stay longer time in the skin. This happened through the CHAC technology. CHAC technology enhances and exploits the natural properties of hyaluronic acid, making an essential vehicle for transporting specific amino acids, vitamins that we want to put in the formulation to have a specific effect onto the cellular activity. So if we are talking about mesotherapy, then we have to understand which one is the function of mesotherapy, and I would like to make you a question. And this one is, what is the function of mesotherapy? It's going to be for biorestructuration, biocomplementation, or hydration. Let's go and see. I'm going to give you a few seconds. You can vote. The biorestructuration is winning at the moment. Okay, so here we can see that most of you have selected biorestructuration, and indeed the native HA, when we put it, is for biorestructuration. The moment we put an extra ingredient, amino acid, vitamin, we're going to complement the activity of the cell. So we are talking then about biocomplementation. But also we will have the effect of hydration. So we have combination of all of them, of all three. How is made the CHAC technology? First of all, we make hyaluronic acid and matrix. We apply high pressure and shear deformation, and then we have the matrix created. After that, we will put the amino acids, the vitamins, and they will integrate into this matrix. So we'll have a three-dimensional CHAC complex. That is the way. We don't add any cross-linking product. We don't add to the formula any stabilization agent. So it's pure hyaluronic acid. Through this mechanical process, we're going to have a final product stabilized that will last longer into the tissue without any chemical binding agents. We're going to have a slow release and a progressive release of the ingredients that we put in the formulation. And thanks to the unique formulation that we're going to have a specific activity on the cell. We have 4 products. One is the Cellbooster Lift, that is created for skin redensification, to lift and smooth superficial wrinkles, but to improve the skin tone and microcirculation. We have the Cellbooster Glow. It's indicated to reduce hyperpigmentation, but we also have nice results with striae. The Cellbooster Shape, that is for localized fat, but also for liquid retention. So we can use it for cellulitis, for example, or for malar edema. And we have the Cellbooster Hair. The Cellbooster Hair is indicated for treating alopecia, but also for treating seborrhea. We will see one by one during the presentation of today. How we make this complex. So we have 3 phases. We put the hyaluronic acid, then we put the active ingredients, and then we have this 3-dimensional complex. Which benefits we are going to have? First of all, the complex will protect the ingredients from the hyaluronidase. So we're going to have a longer lasting product into the tissue. We will also increase the bioavailability of the active ingredients. And we're also going to have a progressive release. This progressive release will distribute the active ingredients to boost the efficacy and will allow us to put components that before could be competitors for the same receptor. And then we are going to have this increased bioavailability. It's a unique proprietary method to stabilize the hyaluronic acid. It's patented by Suisselle and is the CHAC technology. We put the hyaluronic acid, share the formation, simultaneous pressure with vitamins, amino acids specifics for the formulation of each product. So we're going to have a prolonged action mechanism. Cellbooster advantages is will deliver high bioavailability of the components, slow release of the technologies, and will strengthen the skin barrier. So we're going to have results with faster and with less sessions. With only 3 sessions bi-weekly, we're going to have the final result. Let's going to see video about the technology. And let's gonna start with the first of the group that I think is very interesting. Is a new addition to the product line of Suisselle, is the Cellbooster shape. Before we start with this product, I would like to ask you, if you have any question, make it on the box of questions and answers. Don't make it on the chat. And then at the end of every product, I can answer your questions. I will take some time, and at the end of the presentation, I will also take some time for questions and answers. Let's go talk about Cellbooster shape. Cellbooster shape is for reduce localized fat, to reduce water retention, edema, puffiness, and to improve microcirculation and lymphatic drainage. The box is coming with 6 vials of 3 milliliter of product in each of them. As we can see, thanks to this reduction of the water retention, can be used for cellulite. It's a very good product, but also for periocular puffiness and for double chin, but also on the body areas. Remember that it's a product to reduce localized fat. It's not a product to lose weight. So sometimes we can have misunderstandings from the patient, from the desire of the patient, and we have to be very specific with that. Which ones are the key components of Cellbooster shape? Hyaluronic acid, 18 milligrams. Then we have vitamin C and L-carnitine. The program, we have intensive course of 3 treatments every 2-3 weeks, and then we can do a support course, 1 treatment per month, depending on the indication. So we have, for example, cellulitis that is more chronic issue, then will be good to do maintenance program. We can be treated on the subcutaneous layers, on face, neck, décolleté area, and also back of the hands, internal face of the arm, but any part of the body that we have this localized fat problem. So if we are talking about the injection plane, which one is going to be in that case the most optimal? What do you think? Intradermal, subcutaneous, or supraperiosteal? So we see, yeah, most of you said subcutaneous, exactly. For cell booster shape, it's better to inject subcutaneously because we want to reduce the fat or the edema, localize it subcutaneously. So you can see here the results. And I have a question. Is this product suitable for doctors and aesthetic therapists? That depends on the regulation of your country. Suitable for doctors, but for aesthetic therapists, it depends on the regulations of your country, because this is a medical device class 3. So that means that it's safe, that is effective, but can also be injected. So let's go and see the key active ingredients of this cell booster shape is L-carnitine that will reduce localized fat accumulation, water retention and puffiness, and the vitamin C that will help as a fat burning workout booster. How is working this L-carnitine? The L-carnitine is working with the decomposition of the long chain fatty acids with the acetyl-CoA release. This will normalize the metabolic process, will stabilize the cellular membranes, and the skin and water salt balance. So that will mobilize the fat from the deposit, and thanks to this stabilization of the balance of skin salt water, will have a drain effect and will reduce the liquid congestion. The carnitine transports the long chain acyl groups from fatty acid into the mitochondrial matrix, so they can be broken down through the beta oxidation to the acetyl-CoA. So we're going to have usable energy for the Krebs cycle. So we will decompose this fat and we will have used to cellular processes as an energy. Cell booster shape. Let's going to see the protocol of injection. I will present a few of them because we have a lot of protocols, but you will have later at the end the Cell Booster master book, let's going to call it that way, and then you can see all the indications. So for example, one demand that we have a lot is the double chin, and we are going to inject with an angle of 90 degrees on the subcutaneous fat, 0.1 milliliter per point. Let's go and see video of the treatment. It's important to do a marking of the skin one by one for the selected area. We pinch the skin, and while the skin, we have this pinch, we need to have more than 1 centimeter of fat to do this procedure, and then we inject subcutaneously 0.1 milliliters per point. Then we do second treatment after 2 weeks and a third treatment after 2 weeks. If it's necessary, we can repeat this session after 1 month. You can have a little bit of swelling, and you can have some bruising because of the needle, but besides that, you're not going to have any further complication. Other areas that we can use this product: on the face, sometimes we have here on the malar area, we have an accumulation of edema, but also sometimes we have fat deposits. We're going to procedure with the same. We're going to do a marking, and then we're going to inject 0.1, 0.2 milliliters per injection point in an area distributed around 1 square centimeter. Sometimes we want also to reduce excess of fat on the upper part of the nasolabial fold, or sometimes here on the hamster banks, we can also use this product to reduce the volume on this area. You can see that the procedure is very easy and doesn't involve a big risk. Remember always, when we are using products that they are with vitamins, amino acids in the composition, you can never use that on infected skin. neither on inflammation areas. On the body area, we can also, for localized fat, we can also use this technique. We do the marking of the area, and on the body area, on the belly area, you can inject even 0.2 per point. You don't have to worry to inject a little bit of extra product, because we will have more fat tissue to absorb the formulation. And it's very important, the pinching of the skin, and to continue with the pinch while we are injecting. The technique is not complex. And remember that the L-carnitine will degrade the fat through the mitochondria, so we will not have a huge inflammation that we can have with other techniques that they have the oxycolate, for example, on the formulation. We can also use a cannula. I prefer to use a 25 G cannula, and I normally do an entry point with a 23 G needle, and then with a cannula with a fanning technique, I'm covering the area of the treatment. As you can see, I'm tensing a little bit the skin for better cannula gliding. Don't touch the cannula with the glove. And we always need to disinfect the skin. I'm drilling a little bit, and linear retrograde, I'm using 0.5 per line. You see that treatment is very, very easy to perform. I don't know if we have any questions about Cellbooster shape. No. No questions, so I'm gonna continue with Cellbooster Glow. Cellbooster Glow is a product that will also come in a box of 6 vials with 3 milliliters in every vial, and is indicated for moisturizing and dehydration, will reduce also hyperpigmentation, and will fight against the oxidative stress. The indications will be hyperpigmentation, aging, dry skin, sun damage, and environmental sun damage or photo damage, and an uneven skin tone. Which ones are going to be the key ingredients of this formulation? We're going to have also the 18 milligrams of hyaluronic acid, vitamin C and biotin, and then a specific group of amino acids, cysteine, glutathione, glycine, proline, and valine. The program will be the same. We're going to do 3 treatments with 2 to 3 weeks interval, and then we can do 1 support treatment once a month. The treatment areas: face, neck, décolleté, back of the hands, but also the body. And in that case, I would like to ask you, which one will be the correct injection plane for that product? Okay, I see most of you, they are talking intradermal. So we see, yeah, exactly. So we want to target most of the times the melanocyte. So melanocyte is on the basal layer, and yeah, the correct injection plane will be intradermal one. Okay. Which one are the key elements? So glutathione and vitamin C, they are antioxidants, but they are also inhibitors of the tyrosinase, so they will reduce the production of melanin. And we also have the amino acid blends that will supply the building blocks for the collagen repair. So that's very important for healthy and beautiful skin. We have here a diagram. We can see the melanocyte that is on the basal layer, and then we will start to have these dendritizations where the vacuoles with melanin will go to the surface. The tyrosine, via the enzyme tyrosinase, will be transformed in DOPA, and then again via this enzyme tyrosinase will be transformed in dopaquinone, thanks to also oxidation process. So we can do inhibition of tyrosinase with the glutathione, and we can also do an inhibition of the oxidation with the vitamin C. So we will stop the formation of melanin. Tyrosinase, we can see that on the formation of melanin, we can do an inhibition between the dopacron and the 5,6-indolequinone. So we can do an inhibition of all these processes, and at the end, we will have a melanin reduction and more pheromelanin. So the way it's working, this formulation, to metabolic perinuclear level, will be blocking the melanin synthesis, and then post-synthesis, we will block the melanin intracellular transmission. So we are going to have less melanin deposits on the top. This is not that we are going to stop producing the melanin, but we do this inhibition of the melanocyte, so we are not going to have this hyperactivity of the melanocyte, for example, in a melasma, that we have this hyperpigmentation mask, or after inflammation, we will stop this post-inflammatory hyperpigmentation. So we're going to reduce the melanin synthesis. The way we can apply with the techniques, we have different ones. We can have papula if we want to unite skin tone from the whole area. We can do micropapula if you have a specific area that we want to work there. On the body, we also going to have very nice results. And after a skin disinfection, we are going to select the area of treatment. And in that case, I want to reduce, because I see the whole area I have hyperpigmented. So I want to reduce the pigmentation in that area. So I selected the technique papula. I normally use a 32-33 G needle with an angle of 30 degrees. So I'm sure I'm going to be intradermal. The length is 4 millimeters, and I'm going to go covering the whole area. Side effects that you can have a little bit of bruising. If you are injecting too deep, normally it doesn't have to bleed that much. You can see here, we make a few points, and only one of the points is bleeding a little bit, and it can be a little bit uncomfortable for the patient because all the injections are intradermal. So we can do two things, or we can numb the skin with a topical cream, or we can add a little bit of chilocaine or lidocaine into the vial. The vial has space enough, so you can mix this product with your selected anesthetic. So will be more comfortable for the patient. Here we can see some results also on body hyperpigmentation. So we can see that we can use this product for face, neck, hands, but also body. In this case, the pictures are from Dr. Natalia Mikhailova. And here we can see after a trauma, post-inflammatory hyperpigmentation, also with very nice results after the treatment. Let's gonna see if we have some questions. Not for the moment. They are very quiet today. So let's gonna talk about Cellbooster Lift. Is the third one we have in our program. So we're gonna have the same, a box of 6 vials with 3 milliliter per 3 milliliter per vial, and the Cellbooster Lift is the indications are skin redensification, but also to improve skin tone and microcirculation. So we're going to have a good indication that's going to be on cuprosis, but also loss of firmness in facial and tissue contours, skin laxity, loss of skin tone. So it's a product intended for an older demographic, let's going to say 40 plus. The key elements, we have the hyaluronic acid, as usual, as biorestructuration agent, and vitamins, riboflavin, tocopherol, vitamin C, and then an amino acid cocktail. The program is going to be the same. We have 3 treatments with 2-3 weeks interval, and then 1 treatment per month to continue. The treatment areas is going to be the same, face, neck, décolleté, but also we can use this product on the body. We're going to have the key elements. It's going to be the amino acids and the hyaluronic acid that will stimulate the collagen synthesis, will stimulate the microcirculation, and will support the tissue in the healing process. The vitamins will protect the skin from and the cells from free radicals and from the oxidative stress that is in reality what makes us age. The techniques, they're going to be the same, but let's going to see some different videos, so then you can see how we apply it. For example, in that case, I'm going to do this patient with rosacea. I'm going to do micropapula in this area that has worst skin quality. Remember that the patients with rosacea, they can bleed a little bit more because they have all of these little vessels. And then the rest of the area, what I'm going to do is going to be micro droplets, 0.05 per point, but try to inject very superficial. You can see that the skin changes a little bit, the color gets a little bit white when we inject this product. Don't worry, even the product is stabilized, will integrate very easily with the skin. So we do multiple injections to cover the whole treatment area. And in that patients with rosacea, they are bleeding a little bit. We do a little bit of compression, and we will avoid the bruising. Remember that when we have infection, is not an indication for the treatment. So if you have a very exuberant rosacea, that is not the moment to treat the patient. Other areas of the body we can do, and other techniques would be fanning or papula or microbolus. Let's see, for example, on this patient, we want to treat the décolleté. So we are going to do cleaning and disinfection of the treatment area. We're going to do the marking. Look that I'm marking smaller the squares, in that case, around 0.5 centimeters, and then we are going to do the treatment. We are going to follow with the intradermal injection. I tense a little bit the skin for a better needle gliding. I like to use specific mesotherapy needles because they are made for multipuncture, so then they don't get blunt when you are using them. And you see the little papula formation. If it's bleeding a little bit, we can do compression. But if we are using very small needle, 32, 33G, if we do compression for 10, 15 seconds, the hole will close, so we will not have big bruising. Okay. Remember that you have to make your questions on the question and answer and not on the chat, because otherwise I cannot follow to one side and the other one. Okay. Let's gonna see another technique, in that case, linear retrograde. I'm gonna use a 33G needle. And in that case, I want to target the lines, the color lines, that they are not very deep. If they were deeper, if we got already a fault, we need to use a filler. In that case, I have very nice results with Apriline Normal on the neck area. And then I inject linear retrograde following the path of the wrinkle. I tense a little bit the skin. Look that I'm very, very superficial, tensing the skin, and then we simply continue with the treatment. Now I'm going to lift a little bit the needle so you can see the depth of injection. Now let's see, I think it's in this. As you can see that I'm very, very superficial. And then we are covering all the area. Look now, the depth of injection. I am on the dermis in that case. Let's go and see if we have some questions. And then we're going to go to the last one, that is Cellbooster hair. They say, if lift promote healing, shall I use it for stretch marks too? We have very nice results with glow, with Cellbooster glow for stretch marks. Then we have another question. How long does it take for papulas to disappear on the face and neck? Normally it will take between 15 and 20 minutes. In some patients can take a little bit longer. But it's a product that is stabilized. It's not cross-linked. It's stabilized, so we'll integrate very quickly into the skin, so you don't have to worry. Normally, when they leave the consultation room, the papulas, they are already gone. So combination of glow and lift possible. Yes, and I will show some combinations at the end of this webinar, so you can see that you can combine it with other products. Then Isabel Bourget is asking me, which products recommend for acne treatment or acne marks? Well, remember, as I told you, that the contraindication is when we have infection, and acne is active infection. So if we have active acne, I will not recommend to use any product with hyaluronic acid, vitamins, and amino acid, because it's going to be food for the bacteria, so you're going to have explode. Once the acne is finished, and then you want to improve the quality of the skin. For example, if you have a post-inflammatory pigmentation for the acne, you can use the glow. Or if you want to redensify the skin, you can use the lift, or a combination of both of them. But not when the acne is active. Take a note from that. Okay. There are no more questions and answers. So I'm going to continue with Cellbooster hair. It's actually one of my favorites, and is a device designed for strengthening the hair follicles. We're going to improve the hair growth and the microcirculation. We're going to have a better hair fiber restructuring, and we're going to have hair growth acceleration. We're going to nourish the scalp and fortify the follicles, and we will prevent the hair loss and the graying of the hair. The indications is all types of non-cicatricial alopecia, alopecia areata, androgenic alopecia. They are the most common ones, but we have other types of alopecia, like after pregnancy, after radio or chemotherapy, and we can also use to control the seborrhea and for premature graying. We know that the hair follicle, when it starts to get smaller, lose capacity to produce hairs and lose capacity to pigment the hair. So we can have a better color of the hair. But if we have all our hair whites, we will not color them. So it's not a dying thing. So it's for early graying, when we see that the hair is starting to get non-pigmented, wispy, thin hair, then we can recover that hair follicle. The ingredients, it's going to be hyaluronic acid, a cocktail of vitamins and amino acids. Which one are the key ingredients? Well, the zinc and the biotin, they regulate the activity of the sebaceous glands, so they will slow the senescence of the hair follicles and will prevent the premature graying. The zinc and the copper, that they normally are competitors for the same receptor, thanks to the CHAC technology, they will be released consequently with ensuring a proper delivery and activation. The niacin is effective as antioxidant, and the pantothenic acid, the vitamin 5, will prevent the hair graying also and restoring the natural activity of the hair follicle. The amino acid blends, they will reinforce the hair fiber. As we remember, in the Cellbooster Lift and the Cellbooster Glow, the amino acid blend will help to restructure the skin. In that specific blend will help to restructure the hair fiber, so we're going to have a thicker and better quality of hair. And the hyaluronic acid will also hydrate and nurture, so we will moisturize the hair and also the skin around, so we have a better skin quality on the scalp, so we can also prevent and act against the seborrhea. We have two key ingredients, that is the zinc and the copper. They do a competition for the same receptor. Thanks to the CHAC technology, we're going to have a progressive release. First one, that is going to do the activity on the receptor, and second, the other one. The zinc is an indirect inhibitor of the 5-alpha reductase, so we will be very good for these patients that they have androgenic alopecia, and the copper is an essential trace mineral for the chromogenesis, but will also have anti-inflammatory and antioxidant action. The techniques for the hair, we're going to have micropapula, and remember that the area of treatment will always need to be area that there are remaining hair follicles, because this is what we want to stimulate. If we have a bald person without hair on the area, without hair follicles, we cannot stimulate them because they already disappeared. So it's important that you understand how younger your patient is coming for you at your treatment room, better is going to be the result, how faster we attack the patient with this treatment. We can do nappage, we can do micropapula. The injection depth is where the follicle is, so between 0.5 and 2 millimeters depth. So I normally use an angle of 45 millimeters. Select the area with follicles. Yeah, that's me talking. For the video, we are preparing some videos of treatment sessions and techniques, so you can see. In that case, I'm selecting in this patient temporal area that he was complaining, and he got less density of hair. We can see also that it starts with some graying. So we are going to target these two problems with the technique. Some patients, they have a demand for the eyebrows or for the beard. It's common in men to have alopecia areata on the beard sometimes. So we're going to select the area with less density of hair follicles, and we will do micropapula on this area, and then we will continue the rest of the beard with papula technique. Remember that is also painful because we are intradermal all the time. So we can numb the skin or with a cream if we are treating the beard area, or we can simply mix the product with a little bit of lidocaine or lidocaine. I normally use 1 milliliter of lidocaine, 20 milligrams per 1 vial of Cellbooster hair. We can combine with other protocols. As one of your questions. For example, we can combine Cellbooster shape and Cellbooster lift, or Cellbooster glow against hyperpigmentation and Cellbooster lift for redensification. So you can combine these protocols. You can also combine it with other products in the Apriline range, with Apriline Hydro or with fillers. So every area, a specific target, a specific need, and they are very easy to combine. There is not any contraindication to combine them. Let's go and see if we have any questions. Can I mix more vials in the same treatment, or do you suggest to alternate during sessions? Silvia Bonino. Okay, what I'm talking to mix the treatments is not to mix the two vials together. So if I have hyperpigmentation, I'm going to treat this area with Cellbooster Glow. If I have an excess of fat, I can combine in the same session with Cellbooster Shape, but not to mix the vials. Another thing is these products are sterile, but once we open, when we put the needle through the top, they are not sterile anymore. You can have it open, let's go say, for half an hour, but then all the bacteria and everything will grow there. So once you use the product for your patient, then you throw the rest. You cannot save this product in the fridge because it doesn't have any conservant whatsoever that could make it last longer. So once you use it, the product, you shake before using the product, you shake the vial, you check transparency, and then if it's transparent, then you can use it. Then Tamta Mechet Sleeve is asking me how many treatments are needed on average. I guess you are referring how many treatments are needed on average, and what are the intervals between treatments. Same as previous, I'm asking about hair. So you're going to do same as previous, is bi-weekly the treatments, and you're going to see results after 3 treatments already. You will see this better body of the hair, better shine, less hair loss, but will take longer, will take around half a year to have the final results. If you have, for example, alopecia after chemotherapy or radiotherapy, after, for example, breast cancer, then you stop with the chemotherapy. So you're gonna reactivate the hair follicles, but you don't have the cause of the alopecia anymore because you stopped with the treatment. But if you have alopecia androgenetica and you are 40 years old, so you're still producing testosterone, so you have to continue with the maintenance monthly or bi-monthly, always short starting a program of 3 sessions, and then we continue 1 month or every 2 months with 1 session to maintain the results. Should the therapy be combined with PRP or Cellbooster hair more than enough? In my case, with Cellbooster hair, I have very nice results, so I don't see the need to combine them with PRP. But if you want to combine them, you can combine them. And I know some practitioners that on the PRP, they put one vial of Cellbooster hair to enhance the results, because we have these specific things. PRP is a regenerative process, but we have some specific ingredients like the zinc, like the copper peptide, like the cocktail of amino acids that will help to have a better result. Some people, they are asking me for technique for eyebrows. Technique for eyebrows is going to be the same. We're going to do micropapilla following the area, but remember that on the eyebrows, the hair follicle cycle is longer, so you can even take 9 months to have results. If you don't have hair anymore on the eyebrow, will not grow. Remember that you still need to have hair follicles to activate them. Okay. So let's gonna see the combination. If I think we are finished with the presentation, I want to ask you a few seconds after the webinar of today to answer some questionnaire. It's going to take you 5 minutes, and we will really appreciate to have your feedback. You can follow Suisselle on social media, on Instagram, Suisselle Pro, and also Facebook, LinkedIn, and YouTube. And as I promised you before, I would like to share with you the master book, because I know that today was a lot of information, and in this master book, you will have a good explanation about the Cellbooster complexes, about the CHAC technology, and you will find the program, the treatment areas, and also the protocols to use every product. We have been very careful developing all of these protocols, and we specify the injection angle, the injection depth, the volume that needs to be injected, and even the needle type or the cannula that we recommend. So I really recommend you to ask to your distributor which products to have this master book, so then you can have a better idea in your hands how to use them. You can see that this for all the products on the Cellbooster line. You have all the protocols and the way to apply them. Okay, let's go and see if we have more questions. I see Natalia Mirabal is, when you add chirocayendo, does it affect the chemical composition of the drug? No, you can mix it without any problem. We are not changing the chemical composition. Technique for shape for lower eyelids. Well, remember that generally, if you have edema or fat accumulation, is normally on the malar area. Or if you are doing on the lower eyelids, you can do micropapilla, or otherwise, if you have water retention, you have to pinch and then inject where you have the water retention. Stiff remsing. Can all the Cellbooster products be used with mesogans like U225? Yes, of course, can definitely be used with mesogans. There is not any problem to use them, and I have using specifically this mesogan with very nice results. I don't know if there are more questions. So if there are not more questions, I think we are arriving to the end of the webinar of today. We have been sharp 1 hour because yesterday was a little bit longer. I don't know, Katerina, or if you want to comment something.
For me, it's okay. Probably my colleague Valeria would like to add something. Thank you very much.
Yes, thank you very much, Dr. Gabriel Siquier. We are happy to have this presentation. It was very detailed and explanatory. Thank you so much, and hope to see you for the next webinars. And thank you for all attendees to be present, and we wish to see you again very soon.
Yeah, let's see soon we can make a live session that I think is always more interactive. I want to comment that we are preparing all these videos for you, so you can have very didactic material that you can watch with all the indications, the depth, so that will be more easy to understand how to use properly this product. Thank you very much. It has been a pleasure for me, and I wish you a very nice weekend. Bye-bye.
Bye-bye. Thank you so much.